So here we have our surgical table. This is an over-the-patient surgical table that we get from Salvin, and it's adjustable. We have our anesthesiologist set up. We've got all of our drugs. We've got our monitor, and note the little CO2 monitor there. IV pole, we'll open that up whenever Dr. Ed or the patient gets here. Behind the patient, this is kind of our workstation. If you'll notice, I run 2 implant motors. One is for the straight, that will run at 40,000 RPMs, and the other is for the implant contra angle. And we'll use 1 bag of sterile saline, or just sterile water. And then right next to that, we've got our electric artery unit, our Bovie, and then every patient gets that. Down below, we've got our wet drill. It's a 45-degree high-speed handpiece. We've got several different suction devices. We don't really use the blue tube. I don't know why they have it there, but we utilize a canister suction system, so nothing really goes into our trap, and everything stays very nice and clean. It all gets collected into here. And then behind, if you'll notice, we've got this large battery backup and with a headlamp. And so if there's an incidence of down power, we can just plug into that. But this is our surgical setup over here. We've got the 2 foot pedals. Here we've got our Jackson Reese for anesthesiologist. We've got drugs, anesthesia supplies. Over here, this is the assistant area. We've got our Neo converts. We've got our 30-degree multis, 17s, straights. We've got our, this is our Patterson hard reline material, what we use to hook up everything with. Over here, we've got our sterile towels. We've got, everything, our cases in there. We go ahead and have several abutments already opened, and we mark it with a 17 and a 30. And this is all of our surgical setup that we just keep everything very, very, very nice and clean. So, and then all the instruments are starting from right to left as we proceed. So we first start with the Minnesota 15-blade, periosteal, straight elevators, and our forceps, and then our curettes. So we have all of our anesthetics set out. So we are all ready for surgery. The particular monitor that we use is a Mindray Passport. It's got side stream CO2 here. So we monitor the breathing, and everything's really nice.